You're listening to the Autism Weekly podcast. Each week we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Dr. Mary Jane Weiss, a psychologist and board-certified behavior analyst who spent her career advancing the science of applied behavior analysis and its application to autism. Dr. Weiss serves as Executive Director of Programs in ABA and Autism and directs a PhD program in the field. Her work focuses on the philosophical and scientific foundations of ABA, ethical decision-making in professional practices, and collaboration across disciplines. Today, we'll talk about what compassionate, humane, and effective ABA actually looks like in practice. Dr. Weiss, welcome to the podcast.
Thank you so much for having me. Happy to be here.
This is one of my favorite topics. So this is a privilege of mine to get to have this conversation. But before we go down that route and really dive deep into some of the compassionate care, multidisciplinary work, I'd love to hear a little bit of background about you and what drew you to behavior analysis and what's really lighting that fire to kind of push the industry and keeps you going as far as, that drive to want to make it better as time goes on?
That's a great question. Thank you for asking that. It goes way back. I was a psychology major as an undergraduate, and I had an internship, and I was placed at a clinic that served children with ADHD. Very, very severe ADHD, the kind of ADHD that had led to the loss of many educational placements and really difficult daily life impact for both the family and for the individual. And the psychologist I was working with was using a behavioral approach. And I was just amazed at how it changed everything, not just for the child, but for the family. How the interactions in the family went from really difficult and very burdensome to very positive and affirming. And I was also really moved by how the dynamics in the whole family changed. Family members who felt really exasperated and unsure of what to do became empowered and confident about things that would actually make a positive difference for their child and in their family life. And I was so drawn to and so impressed by the fact that the whole goal was to really work ourselves out of the equation and to help this family make their own lives more functional and their own lives better, and to really kind of lean into that from an empowerment perspective. And so I learned that I really loved working with children and families, and that I really loved the behavioral approach because of that empowerment, because of the partnership that you engaged in as a clinician, working with the family to improve their lives and situations.
I love the fact that you're focused on empowerment. And I think that the more that we can get all clinicians thinking empowerment first, I think the other skills are a lot easier to start developing because conceptually you're starting in the right place. But when you started in the field, was that always the case? Was that the forefront decision-making factor in autism services when you originally started in the field?
I mean, everything about the field of ABA when I entered it in 1984 is when I started graduate school and really was introduced to ABA in its application to autism. Almost everything that I learned in the 1980s is now either unethical or antiquated at the very least. Literally, everything about skill acquisition is antiquated. Most of what we did from a behavioral intervention perspective is now considered wholly inappropriate. And so I think it's an entirely different world of intervention in every way, as it should be. I tell my students today, listen, hopefully in 40 years, everything I'm talking about today with you will be antiquated or unethical, because that will mean that the field has done its job, that we have evolved as a science, and that we have also been shaped by social movements and by standards of care and by all of the other influences that should, in fact, alter what we do in intervention. And so it gives me a lot of hope to have been in the field this long and to have observed that evolution, that radical transformation of what is best practice, because it shows me that the field is committed to that continual change of focus.
Absolutely. That's discussions like these that I think that continue to drive curiosity. It drives research and it drives us to be better clinicians. But there's got to be a core set of principles that I would imagine that have evolved over the years, where maybe in the past that you were looking for something that was more systemic, routinized, that you were looking at being able to change behavior rather than being able to empower or adapt behavior. Like there's different core principles that I think are in place. What are the ones that you find to be most important in the everyday practice of ABA right now before you even get to treatment planning, but that are kind of those core ideas or foundations that are so crucial when you're doing any sort of concept formation around ABA?
I'm so glad you used those words in terms of core principles, because in fact, the new ethics code, the most recent version of the ethics code, which came into play in 2022, developed in 2020, for the very first time, the Behavior Analyst Certification Board's ethics code invoked core principles. It's something that had been present across many other human service professions for many years. And actually, I had always borrowed from psychology in training my students of behavior analysis, introducing them to the core principles from psychology and other professions. But now we have our own set embedded into our ethics code, and it includes some of the most bold statements, the framework we operate within: benefit others, treat others with compassion, dignity, and respect, ensure competence. Like these are, and to behave with integrity. These are the compass, right? This is the compass that guides us. This is the check on our behavior. Are we in keeping with the core principles in everything that we do? And I feel like it's a framework that you bring to the work. And we always had those values, certainly within the profession, and we always could borrow from allied professions for that language. But I think it was a really important change for the field to enact them as part of the ethics code, because the message is so clear about them being the foundation on which everything you do emanates.
And from your vantage point, I mean, you're in the academic world.
Yes.
You've been in the practice world.
Yep.
So you have viewpoints of everything from concept to implementation. Um, where are we right now on being able to make sure it's embedded into education systems? Is that I could tell you is that when I went through my master's program 30 years-ish ago, that wasn't there for ABA. And it's something that now is that if I keep up on all the ongoing research and everything that's coming out, it's yes, I'm getting that information. But new practitioners, you almost have to make sure that it's really highlighted, focused all the way from their education through their supervised field work, through their practice, their ongoing education. Where are we right now in the academic world as far as is this part of curriculums? Is it being talked about enough? Is it embedded in the material?
That's a great question. And I think that we have made tremendous strides. In the last 8 to 10 years, there has been a radical transformation of the extent to which these topics are being talked about. And I do think that the values are foundational and were always there. In that way, I don't think this is new to
Hmm.
ABA conceptually, But I do think that something had happened in possibly the very rapid expansion of the field, the fact that we kind of overnight became a healthcare industry with insurance reimbursement becoming possible. And I think that some of that rapid growth resulted in less emphasis of some of those more nuanced skills in people's education and training. And I think that the very good news is that the spotlight on these issues that has been shown for the entire field has really resulted in a tremendous amount of consensus and a tremendous amount of convergence around the need to really bring these values, behaviors, and teaching and training of these skills to the forefront of everything that we do. Some things have helped. Having it in the ethics code so explicitly has certainly helped. In fact, the critiques of the profession that have been leveled at ABA from neurodivergent voices and others have also helped to kind of create the crisis for the field to react to. And it has not been an easy time. It has been a difficult time to be a behavior analyst in the last few years. As somebody who's been a behavior analyst for a long time, the last decade has certainly been the most difficult from a public relations challenge and from some of the pain points that have come from these discussions. But it's also been very heartening because of the way the field has embraced the need to talk about these topics, the need to make real progress on defining, measuring, teaching, and training these skill sets, and on the kind of unity that it has brought to the importance of these issues being front and center in what we do.
So let's dive into some of these topics, because I think that when we're talking about being a great practitioner, is that ethical decision making is at the forefront of every single decision. It's got to be there. You have to be thinking through what's appropriate for this particular individual. So having individualization, compassionate care, making sure that you're looking at it from a holistic viewpoint, you're understanding the effects, the goals, what that person cares about. All of that should be in every single decision. But so let's start there. Let's talk about compassionate care in general, because that is one of those core values that should be embedded in decision making. How do you define that? What do you look at so that it isn't just a key word, but is actually something that people can feel, see, understand? So how do you define compassionate care?
That is a great question. And if you look at the definition of compassionate care, whether you're talking about within behavior analysis, within psychology, within allied health professions, or even in the dictionary, you'll see that two threads are always embedded into the definition. One is this concept of empathy, of seeing in another the struggle, for lack of a better word, that they might be experiencing, being able to notice and understand and see that in another, paired with the second component, which is some kind of intentional act that's designed to improve their circumstance. Sometimes you'll see that definitionally as alleviation of suffering, which is controversial, which I understand. Some parties respond very negatively to that, as if we label the experience of people by definition as suffering, and as if we possess any capacity to alleviate that suffering, right? Both of those assumptions can be problematic or offensive to some parties. So having said all that, those are the components that you'll see over and over again in the nursing literature, in, the dictionary. And so we're a little bit stuck with those components. The way I've kind of come to think about it is I do like the fact that it includes awareness of the other's experience. And I think about the action as kind of more in partnership with those we serve. So can we partner with them to work with them toward their identified goals?
Yeah.
And in that way, I feel like we have kind of a functional definition of compassionate care that reflects that empowerment, that reflects the partnership that should characterize our work with those we serve. And so that's kind of where I have landed in that context. And what it really means is that we have to actively work to ensure that we're paying attention to the entire context, that we're paying attention to the social validity of it. How does this person feel? What
Mm-hmm.
would they say about the intervention? Not what would I say about the effectiveness of the intervention, but what the individual themselves, what the caregivers of that individual, what the real world difference is from their perspective.
Yep.
Because if we land on some kind of topographical behavior, like it means nodding and it means saying, I understand, that is not compassionate care. We have to make sure that we advance that definition to be individually relevant and indicated as meaningful by those individuals themselves.
Okay. And when we go back to that original thought of, was this originally embedded in a lot of ABA, I would say is that social validity has always been spoken about. How we
Absolutely.
define it now might have changed because of the times have changed. More knowledge has come out, better awareness has come out, more advocacy has come out. But that's still a concept that we've all shared. And I think the way that you've painted the picture for me is the way I'd see any therapy, is that it is self-determined, is that you're going for
Absolutely.
therapy for something. I want to get out of therapy, and you need to figure out what those goals are. Um, with a lot of BCBAs is that they get stuck though, is that when that goal that's being expressed by an autistic or a autistic advocate or a family member, when that goal doesn't fit what they're thinking about as far as the best clinical decision. And I'd love to hear your thoughts on that because I don't think the best clinical decision is the one that doesn't fit with somebody's goals to begin with. Is that should be thought about? But do you see that juxtaposition from BCBAs or clinicians at time where it's like, no, I know this is the best decision that for me clinically, if I were to do it on paper, and getting over that hurdle?
I think that that is a problem in teaching and training, right? So I'm going to point the finger right back at myself and others who serve that kind of a role. I think the piece of it that we've maybe been strongest at is science is your compass. Use evidence-based practice, use effective intervention. What distinguishes us as a profession is our reliance on those
Mm-hmm.
science-based treatments. And that is true. And we hold very dear the need to be effective. That is also in our ethics code. And I think it gets confusing for clinicians sometimes who are trying to do the right thing, so to speak, in these regards, and who don't know how to navigate when it doesn't quite align with what I think the very best, most effective thing to do might be in this context. And so it's about also training up the skill set about those contextual variables, about those nuances. What's going to work with these individuals, with their stakeholders in this environment, in this
Mm-hmm.
context? What are the other variables that I need to be thinking about in this regard to make sure that we all land on something that we feel good about, are invested in, are likely to do, and don't end up having people feel alienated by the recommendation. And so I think it's all part of the skill set, but it may be the case that we have overemphasized one aspect of that skill set and underemphasized the other, which is why these kind of growth patterns we've seen in these dialogues and these nuanced discussions of these skills is so important in terms of revisiting the whole skill set and
Mm-hmm.
prioritizing the development of different skills.
So how does that play out in practice when a clinician has prioritized being aware, having those interpersonal skills of communication and listening and being able to value somebody else? What is it that you'd be getting out of therapy if you don't do those things? And what do you get out of therapy if you do engage in those behaviors and as a clinician and empower your clients? That might be a broad question, but I mean, there's got to be certain things that you're limiting from the patient if you're not really harnessing your interpersonal skills.
Exactly. And I think as a field, we have not emphasized the development of that interpersonal skill repertoire to the same level that other allied helping professions have. And I think that also there's a little bit of a barrier to it sometimes in the way behavior analysts think. Like, well, what is that? Can we operationally define that? How would we measure that? How would we actually collect data on that? Isn't that what sort of those other people do that we do not do? That kind of a leap in terms of, okay, how is this congruent with our worldview? How do we bring this in a way that's conceptually systematic? But I think the great news is that it absolutely is teachable, trainable, measurable, operationally definable 100%. And I think it can be done in a way that is totally congruent with our approach. But you're right, those skills involve things that maybe we didn't used to think so much about. How do you identify when to compromise? How do you resolve conflict with another individual you're collaborating with? What if you really do have discrepant opinions on this? And how do you come to resolution in a way that respects science as your compass, which is still true for us, but also enables you to protect that collaborative relationship, to have everyone feel heard, understood, and valued? And so it's complex. And it requires really a lot of attention to contextually relevant aspects of the interaction.
And the interpersonal skill doesn't just stop with a client relationship. One of the big areas, I think, of emphasis, and I think a gap in ABA, the way that it had been practiced historically, is that it was siloed, is that there wasn't a lot of communication with the other care team partners. And it is a partnership. The things shouldn't stop just because you leave the room or leave the walls, as all of these skills need to mix together. Is that another area that you're really kind of trying to help your students understand and evaluate the research around, is how to make sure that all of the disciplines work together to be able to support a common goal, which is defined with the client?
Absolutely. I think that autism is complex, multifaceted, and behavior analysts do not have all of the skills to comprehensively intervene without the expertise of allied professionals. And the more complex the needs are, the more there is a requirement for more comprehensive care. And I think that that is vital to outcomes for the individual. And I think it's really important for behavior analysts to be introduced to that concept of best practice is multidisciplinary, interdisciplinary care. Best outcomes are going to be achieved in that context. But one of the components of that I think hasn't been emphasized a lot yet in teaching and training of behavior analysts is the appreciation for the expertise that members of other disciplines possess. There are things that the occupational therapist is trained in that I have no knowledge or expertise in. And that information is vital for these individuals that we share. Same thing for speech and language pathologists. They will always be more expert than I am in the areas that they excel in and should be deferred to on, content that is more specifically in their purview. Now it's complicated because there's a shared scope of practice. There are things that we all perceive having a role in. And so we really need to work on the appreciation of those disciplines, the contribution that they make, the way to work together, the way to resolve conflict. some of those same themes that we talked about that could come up with other stakeholders like family members also are relevant in this context.
And everything is supporting one general goal, which is what you talked about earlier, is empowerment. I mean, if we can empower somebody, we've all done our job successfully. And I have a bias on this, I'm already going to sway the question with my bias, but I do see that because ABA is oftentimes intensive in the hours that are being provided, is that their role in care coordination becomes that much more important. Their ability to reach out to all these other stakeholders or members of the care team becomes critical. And passing that buck limits the ability for a client to get the best care that's going to be possible. What do you see, and how do you teach that idea of care coordination and responsibility of care coordination? Where does that fall on the ethics code? Like, how does all this come together?
Well, one other good news point from the ethics code is interprofessional collaboration is highlighted explicitly in a few places in the ethics code, and to a much greater level of specificity than any prior versions of the code. I would say that I believe it was always in there too. It was always valued, but the language around the explicitness of its importance has really improved. And that's good because the messaging is there to the profession about how vital it is to collaborate with others in the best interests of the clients that we serve. But like we talked about with compassionate care, I think valuing it is not sufficient. There's also skill development. Yeah. And so I think that we're at the beginning stages of identifying the vital skills that are important for interprofessional collaboration as well, and for people to be demonstrating that. What we've seen in the past few years from a research perspective has largely been a bit more qualitative surveys that show the challenges that exist in coordination of services between behavior analysts and members of other professions. That's important. It's helped us recognize we need to do better and we need to focus on this as a skill set, but it isn't sufficient, right? And so now I think we're starting to see much more explicit attempts to define the skills that could be important in this context and teach and train them. So I'm excited about that.
No, and it's funneling down. I mean, you're starting to see it in clinical standards, accreditation standards. You're seeing it everywhere, which once something gets highlighted and prioritized, that's where it starts to change the way that people are interacting and implementing particular ideas and concepts. And I'm glad that it's moved that direction. You've had the chance to be involved with the development of so many different people's skill sets throughout your career. Just, I mean, as a professor and a practitioner, is that you've really helped to groom and shape a lot of provider behavior. For families that are going into this process, it's like you said, it's a fast-growing field. There's a lot of people that are on a variety of different parts of their journey of learning and developing these skills that are so crucial. What's one thing that a family should be looking for when they're trying to figure out a provider that fits for them? I mean, what are the questions, or what are the hallmarks of, this would raise a red flag or this would be a green flag kind of going forward?
Great question. And you're absolutely right. I mean, every profession probably has variability in the skill levels of the individuals who hold those credentials. But we are at a unique moment in behavior analysis. We have many junior members of the profession. We are largely newly certified individuals with fewer people with lots of experience to guide them. So yeah, I think it's appropriate to think about those things and to think about the importance of selecting based on certain characteristics. I really think the focus on partnership is one that families could actually ask about. That I'm seeking a provider who's going to see us as partners in the process, that's interested in our self-identified goals. Are you a provider that that really wants that level of partnership with the families that you serve. And I think asking about what happens if we disagree, what happens if we raise something that you think our individual is not ready for, what are some of the ways we could work that out between us? I think that asking questions around that is perfectly appropriate and would give you a sense of how this individual is going to approach difficult conversations with you as a family, and the extent to which they're really focused on individualizing based on what your family is prioritizing and needing.
And on the flip side, for a provider to actually have thought through a lot of those concepts is that I would imagine if I go in and I ask a variety of providers, what do you do when you disagree with a patient or with a client, is that a lot of them won't have that answer right off the top of their tongue, which means when they're asked by a client, it's not going to feel genuine. And what you're discussing is humanizing that relationship. I feel like it's helping somebody to feel like they matter and that they're valued and that their voice will be heard from day one through the end of treatment, which is so crucial. So I think that question that you just asked is one that I don't think that I've asked a lot of providers what their response would be. And I think I might start doing that now just to get a general idea. I think that really pulls a lot. So, I mean, we've talked about compassionate care. We've talked about ethical decision making. We're hitting on the broad strokes of everything. What would you want somebody walking away? What would you want a clinician walking away thinking or asking or wanting to know more answers about from our conversation today?
I would want them to feel hopeful because this is such a difficult time. We encounter a lot in the press, in social media. There's a lot of anti-ABA sentiment. The industry has been plagued with some problems with ethical practice, but also it is true that this field is filled with wonderfully devoted professionals who have really responded to these challenges with professionalism, with dedication to improving the profession, and with advancing their own skill development in these areas. So I want them to stay in contact with that hopefulness and to be proud of the profession and not just burdened with the negative press that we're experiencing about it. And I want them to recognize that in a very short period of time, an immense amount of work has happened in these areas, and that we're not fighting about compassionate care, interprofessional collaboration, assent-based learning, ethical practice. We are endeavoring to advance it for all of us. And I think that that is the thing that gives me the greatest amount of positive feeling about the moment that we're in.
Yeah, and I think that's healthy. I think that's what we all should be kind of doing is in the skills that you listed today, if we focus on those, then ideally what's going to come out of that is that the 95% of good practitioners will define the field and not allow the 5% that maybe are struggling or having difficult unethical decision making to be the real definition of the service and the science that we're providing. But I think it does start with all those skills that you mentioned and really focusing on, harnessing those abilities and putting them directly into practice. So they're not words you're saying, but things you're doing. But Dr. Weiss, I appreciate your time today. I love this topic. I love the fact that you came on to share your expertise around it. And hopefully we can continue this conversation another time.
I'd love to. Thanks for having me.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.